When you were a child, did you like eating sweets, but your parents just kept telling you that you should cut down on your sugars? All they said was it's bad for your teeth. Well, this isn't entirely wrong, but eating too much sweets can also increase the blood sugar level in your body too, forcing your body to work harder to bring it back to normal. This can be a very serious case for children with diabetes who can't regulate their blood sugar levels. To think of it, I guess it must be sad for those children when they can't have as much candy as a healthy kid. To help them, can you think of a way to lower their blood sugar level? Pause this video to think about it. The answer will be revealed as you continue this video. Hi everyone, I'm Priscilla. This video is dedicated for the King's College London summer programs under the unit Drug Discovery. In this video, I will be discussing how type 1 diabetes can be treated with a new drug called Teplizumab. Before we go into anything technical, did you know that in 2021, the International Diabetes Federation's IDF Diabetes Atlas reports that about 10.5% of the adult population suffer from diabetes. Among those, about 8.75 billion people suffer with type 1 diabetes, which accounts for about 10% of the diabetes population. That is a huge number of people that require health attention. Now you might be wondering, I know diabetes, but what exactly is type 1 diabetes? Like, what is the biology behind all this? Well, to really describe what type 1 diabetes is, I need to introduce you to the pancreas. The pancreas contains many different cells, but here we'll focus on beta cells. The role of beta cells is to secrete insulin, which lowers our blood glucose levels. However, in type 1 diabetes, our immune system mistakes beta cells for enemies due to their funny tag lying around on beta cells. Our immune system destroys it, leaving none left in the pancreas. As a result, patients with type 1 diabetes do not have any functional beta cells, meaning no insulin is produced, and without insulin, blood glucose levels cannot be regulated, leading to diabetes. Now, if you're confused with type 1 and type 2 diabetes, an easy way to identify is that type 1 usually develops in early stages of life, whereas type 2 develops with obesity. Another way to physically tell them apart is by looking at their appearance. Type 1 patients usually look underweight, while type 2 patients appear overweight. Some symptoms of type 1 diabetes are having sudden weight loss, abnormal thirst, frequent urination, and more that are not stated here. Now moving on to the current treatments, did you have an answer from the question I left you with at the start of the video? Well, regardless, the answer is actually insulin shots. Type 1 diabetic patients are required to take in 2 to 3 insulin shots daily before meals, which can be an annoying and frustrating process over time. And this brings us to this novel treatment for type 1 diabetes, using the drug Teplizumab. Teplizumab is a drug that was approved by the US Food and Drug Administration, FDA, in 2022 to delay the onset of stage 3 type 1 diabetes in patients aged 8 and older who are currently in stage 2 of the disease. The ultimate goal of this drug is to promote immune tolerance and preserve insulin production in diabetic patients, which also decreases their need for constantly taking in insulin shots. You might immediately realize that, hey, this is just a treatment, not a cure. Why should we even use or invent this drug? Well, it is also worth noting that delaying the diagnosis of type 1 diabetes is highly significant, as this helps to avoid or prevent any serious complications such as eye, kidney, and heart disease, which may develop alongside diabetes. The later you get caught in these diseases, the less you suffer and you get to enjoy a longer, higher quality of life. Now on to the serious stuff. To fully understand how this drug really works, we need to recall that how type 1 diabetes actually develops. A few minutes ago, we said that type 1 diabetes is caused by the immune system attacking our beta cells. Now, the immune system is complex, as it contains so many different cells, all with different roles. But for simplicity of this explanation, we'll focus on 2 key players, CD3 and T cells. CD3 is like the mastermind. It sends the go and attack signal to T cells to attack the beta cells. So technically, you could say that CD3 is the main culprit of all of this. Anyways, this is when our drug, Teplizumab, steps in to prevent CD3 from sending these attack signals to the T cells. Basically, it just says, stop, to CD3. As for the T cell, it has been waiting for centuries now for the go signal. Just kidding. Since it did not receive any signals, it just gets confused, and without a job to do, it eventually self-destructs. But you might ask, if T cells stop attacking our beta cells, wouldn't that mean our beta cells can live happily ever after? And there would not be any more sad stories such as the person getting diabetes? Unfortunately, this isn't entirely true. Well, you see, our drug isn't Superman. There are so many other contributing factors to the disease progression that our drug doesn't address. So you might start to wonder again, is it really worth taking this drug since diabetes would eventually develop? Well, let's state some facts here. So far, a study found that a 14-day course of teplizumab delayed the progression from stage 2 to stage 3 of type 1 diabetes by 48.5 months. That is about 2 years, which means 2 more years of high-quality life. There have also been studies proving that teplizumab has also improved beta cell functions. This means that patients will require fewer insulin shots and will experience less suffering. Teplizumab was also shown to be effective across all age groups, but it seems like the younger patients showed a better response than older patients. Most importantly, multiple studies have confirmed that the consistency of teplizumab's efficacy, indicating that its biological effects are robust, reproducible, and not unique to a specific study or patient characteristic. However, everything has its good and bad side. The downside of this drug is that the effects of teplizumab treatment can vary based on the stage of type 1 diabetes and the level of beta cell reserve at the time when treatment begins. Well, I guess this makes sense since teplizumab drug cannot revive your dead beta cells. In addition, the cost of a single course of treatment is approximately $200,000 US, which can be a significant barrier for treatment. And of course, there are several side effects for this drug, including low white blood cell counts due to the self-destruction of T cells, as well as nausea and rashes. Fortunately, there are currently no observed long-term effects, and white blood cell counts typically return back to normal within 6 to 8 weeks. To sum up, teplizumab seems to be a very powerful drug in delaying the progression of type 1 diabetes with strong statistics to back it up. However, this drug is only used to manage the disease, it's not a cure. Currently, teplizumab has only been approved in the US and more studies about this drug is still undergoing. If you're interested in it, you may refer to this list for further reading. Anyways, I hope you have learned something from my video today. Hope to see you soon. And be careful of your sugar intake, otherwise your beta cells might be complaining. Anyways, see you next time. Bye.